Hi, Dr. Carl. How are you today?
I'm doing great. Thank you so much for asking.
Yeah, thank you for coming to Align and Thriving. I'm very excited to talk to you today because actually I've been learning about light therapy recently. A lot of my colleagues are using it and I never really paid attention to that before. And now I'm a lot on Instagram and I saw them using it a lot. So what sparked your interest in red light therapy? And how did it evolve from your chiropractic background into your life's work?
So, I was a junior at a very good college in New York called Stony Brook, and I was a biology nut. I mean, I loved everything to do with science and biology in particular. I had won scholarships. I'm only mentioning this because I had no idea how that was going to translate into a career for me. And then what happened was some people, one particular person, mentioned the word chiropractic. Now, I want to tell you that in 1972 in New York, chiropractic was looked about two steps below voodoo and maybe even two further steps below a bunch of crap. So it wasn't well respected. It wasn't well thought of. But yet and still, I decided to do some research on it. And I called a lot of chiropractors all over the country. And everyone I spoke to loved what they were doing. Now, in 72, I was young. I was, again, a junior in college. And my concept was that I wanted to help a lot of people and money was not going to be my focus. So I don't mind making money, but till even today at 73 years old, I still focus mostly on how I can help people rather than how much money I can make. So yeah, I loved it. I decided to become a chiropractor in 1978. I did become a chiropractor and I had a lot of fun with it. I mean, I was successful. Let's put it that way. But then about 20 years into my practice, now remember, I'm a wise guy from New York, knows everything. And I get introduced to red light therapy by a medical doctor who had brought this technology to the United States about 20 years ago. I mentioned medical doctors because they haven't really taken to red light therapy that well because they'd rather do the surgery, to be honest with you, where they can make a lot more money than if they use red light therapy and avoid surgery. No one's getting rich, by the way, off of anybody who's healthy. Healthy people don't generate a dime for people in the health industry, especially in the medicine and surgery world. We haven't really had a lot. So I'm just saying it's kind of ironic that the person bringing this technology to the United States was an orthopedic surgeon out of USC. And he was also a professor there. And I thought he was nuts. You know, he comes to me and says, come and help me save the world. He hands me something about this big. It's a flashlight. And he said, shine this on your patients and it's going to make a big difference. And I thought he was crazy. Well, honestly, but I told him that we would try it in our practice and out of respect, I had known him for years and we started using it and it really made some changes using equipment that was thousands and thousands of times weaker than what we currently are using. But even so, back then we had some nice results. And it just piqued my interest even further. And so I got more and more involved with more advanced technology and it kept on going. And then about 14, 15 years ago, it was discovered that there was an element of light, red light in particular, no other color, no infrared, red, only red, could actually help with fat loss. Now, in the United States, there's not that much more popular than fat loss, study of fat loss, selling fat loss. And imagine doing it in a way that's completely healthy, destroying anything. You're not freezing the fat, boiling the fat, lasering the fat. You're not using radio frequency or ultrasonic cavitation, which is all about destroying the fat cell. The technique I'm going to tell you about doesn't do any of that. It's all healthy, it's all natural, and it helps with reducing fat in certain parts of the body. And what they discovered, now in the beginning, they thought maybe it melted the fat or something like that. That's not what happens. What they discovered is that a certain element, red light, again, only red light, could actually change the fat cell wall temporarily, just for a few hours, to become more porous. And when it's more porous, it allows some of the contents to leak out into the surrounding tissue. And then with our unique protocol, remove the fat away from the fat cell, and eventually to the liver for use or elimination. And within a few hours, the cell is back to normal.
I've never heard of that before. I've never heard of that before.
It's not subtle. And in fact, I am going to go over something with you. I can go over it now. It's called Google Scholar. So if you go to Google Scholar, which is a version of Google, but it's the scholarly version. So it's actually scholar.google.com. Scholar.google.com. If you go to Google Scholar and put in the word photobiomodulation is the study of light, how it affects the body. I'll send that word to you as well. And then if you put in after the word photobiomodulation, anything that might be of interest, like fat loss, like lupus, I don't know, anything you can think of, put it in there and you'll see the research that has been done. Double-blind studies research, university articles and papers and stuff like that. And you'll find hundreds of different studies that have been done for each of these different subjects I'm bringing up. And it's incredible. It's wonderful. And the studies are there. It's not, you said you hadn't heard of it because there's a lot more money doing surgery and a lot more money in doing drugs than there is not doing those things.
No.
So what is more popular now than these injections that people are getting? And quite frankly, the average person is not really looking into how these injections might somehow affect them in a negative way in the future. What side effects? What they found is that there's more cases of pancreas problems, pancreatitis and things like that, since they've been using these injections by hundreds of times more frequent than they used to be. Okay, I'm not going to get involved with that too much. But in fact, in my discussion with you, I want to make it clear that I'm going to be reporting the news. I'm not making any claims. I'm not going to tell you not to see your doctor. I'm not going to tell you don't get treatment for your ailment if you're already getting that treatment. I am going to tell you that you should look into red light therapy. And when I'm done, I'm going to reveal some miracles that I think will blow you away with the kind of results that we're seeing. So at any rate, there I am 14 something years ago, learning how certain elements of light could help with fat loss. So I started manufacturing back then. And we were involved with lasers, pads, things that were covering parts of the body. And that becomes significant because a few years ago, when COVID hit, several years ago, when COVID hit, our practitioners wanted less physical contact between the patient and the provider, if that was possible. And we came up with a bed. And so the person can get in and out of the bed themselves. You don't need staff. They get in it. There's a canopy that comes down onto their body, not the weight of it, but it approximates their body. So the lights come very close to the body. And when we did that, now remember, instead of putting pads or lasers on people, we're covering the whole body, head to toe, left and right, front and back, and inside and out, covering so many cells of the body. That's where the miracles start happening. So let me give you an example of one of many miracles that we're seeing. Arnett calls up one of our practitioners and explains to them that he's having a heart attack once, if not twice, a week. It started 13 something years ago when it was once a month, twice a month, and it got more frequent. But so eventually it got to twice a week. And he called this practitioner and said, would you treat me? And when the practitioner called me up, says, maybe I shouldn't even treat him. He's having heart attacks. I don't want him having a heart attack in my office. I said, no, normally a dose is 12 minutes. That's all it takes is 12 minutes. But in this case, let's just treat him for 5 minutes and stay in the room the whole time with that patient. That patient went home that night. Now, that was about 2 years ago, and he's had more treatment, but he's never had another heart attack. Hundreds of heart attacks, no more heart attacks. Dying, and now fully in life. I mean, he is doing great. Every organ, every tissue, everything in his body has come back to life. And one of the things that he says in his video is that what he didn't expect is that his energy would actually go through the roof. And he talks about many other things, and I'm going to send you these videos. They're testimonial videos. They're on a spreadsheet. Now, if you know much about spreadsheets, there are several pages within this spreadsheet. So the first page, it says on the very bottom, it says patients. The next one, it says providers' testimonials. And the next one says miscellaneous testimonials. If you watch especially the patient testimonials, I think that if you're crazy like me, wanting to help people, when you watch this, you'll know that this is the road to another path to well-being for people. And again, we've never seen these kind of results before. And I'm going to go over why and how it works in a moment, but I just want to give you another example. Lyme disease. Now, wasn't sure if it was going to be able to help Lyme disease.
Yeah.
And this one guy, his name is Steve, watched that video. Steve gets in our bed. Now, it had ruined his life. He contracted it when he was 12. He didn't get into one of our beds until he was 40 years later, in his 50s. So for those 40 years, it ruined his life. He had no energy. He couldn't have a career or go to school, for that, because he never knew whether he was going to be able to make it, because sometimes just getting out of bed was a big ordeal. And certainly getting back to his apartment out of his car was another big ordeal some days. Some days it was horrible brain fog, energy loss, things like that. So when you watch this video, it's shocking when you see him say what changed in that first treatment. So I'm not going to tell you any more, but watch the video on Steve. And of course, watch all these others, including Arnett with a heart attack, and Jerisha, who had a stroke, and Jessica, who had 16 unbelievable serious problems. She had goutte psoriasis, plaque psoriasis, and psoriatic arthritis. She had migraines. She had kidney stones. Not one, not two, not five, hundreds of kidney stones. And to watch this video, another one of these startling, goosebump making kind of things, if you're crazy like me and like to help people. So there I am, we've got COVID hitting and we created this bed. And that's what we found, is that when you bathe the whole body head to toe, that's what made the difference. And that's why we're starting to see miracles. So when people get in the bed, it's very easy. They get in the bed, out of the bed themselves. And that's why it works so well for COVID. Again, we didn't expect these kind of outrageous kind of successes that we had. So I want to educate you guys a little bit and go over a few things. But first, I'd like to introduce you to the website. It's trifectalight.com. Now, trifecta, the tri for triple, meaning skin, fat, and healing. The skin's going to look fantastic. I don't care if you've got anything on the skin, you're probably going to have very beautiful results with this. Like Arnett, that was having the heart attacks, also had black moles on his face, and they were raised. And when we see him again, when we do the testimonial video, he was not thinking about that because the heart attacks were so important to him. But we noticed his face was completely clear. So the skin's going to look just fantastic. Then also we talked about fat loss. And then the other thing that I love is the healing part. Any tissue in your body could be subject to great levels of healing. So that's the trifectalight.com. And when you go there, I want you to go to the Contact Us page. Besides reading as much as you want on the website, go to the Contact Us page. And on the left side of that page is an opportunity for you to find the location closest to you. Because I'm going to tell you something. If you have a problem, if you have an ailment, you are no longer allowed to complain until you've used this bed 6 times. And at the end of the 6 visits, you might need more visits, but at the end of those 6 visits, you should notice a difference. Like way over 90% of people will notice a significant difference. In some cases, like with Arnett, the heart attack stopped in 1 or 2 visits. In the cases with Jessica, it took a couple of weeks. For the psoriasis, she had bleeding ears and rashes across his face, down both arms. And within 2 weeks, that was all gone. And the swollen toes that she had from the psoriatic arthritis was gone within 2 weeks. So on average, if someone goes 3 times a week for 2 weeks, at 6 visits, they're going to notice a change. So I'm going to ask each of you to go to the trifectalight.com website, go to the Contact Us page, go to, on the left side of that, request to find a location closest to you. Now, I'm not in practice, so I'm not inviting you to my office, and I'm going to tell you I don't have any financial investment in this. I will not gain financially from you visiting these offices, but it's going to give us a great thrill when you contact us back, because you're going to go back to the website, and on the bottom of the contact us page is just, you can just send an email to us and tell us what happened after 6 visits. And I would be really surprised if you don't see nice changes. Again, you might need a lot more visits. If you have, I mean, if you think of any ailment like Parkinson's, dementia, Alzheimer's, multiple sclerosis, autoimmune disease, I mean, any autoimmune disease, kidney problems, diabetes, heart problems, Lyme disease, any skin issues I already described to you, any musculoskeletal problems, any muscle, tendon, ligament, bone, joint, any of that stuff responds beautifully. And then even neuropathy. Now, nerve and brain, the healing of those tissues are very slow and difficult. And yet, and still, we see beautiful results with neuropathy, where people are barely can walk and now they're walking. We had a guy, his name is Joey. Now, Joey had tooth disease, which is a form of an autoimmune disease, which guaranteed him 15 years of pain and not able to walk. And after 6 visits, he gets interviewed by the practitioner. And one of the things that he said was, "I want to thank you for giving me my life back." And you know, that thrills me to no end when I hear that. And to hear people, their quality of life goes sky high. So he's walking, after 6 visits, he's walking treadmill, walking his dog for the first time ever, because he's been disabled for that many years. So imagine all these different conditions. And it's hard for people to believe, and trust me, that it's global. It's every tissue in your body can conceivably respond to this type of therapy.
Okay. So I have some follow-up question. The first one would be, so this therapy, you have to go to a center. It's not like a bed that you can buy and have at your own home. You're not selling that for people to have them at their own home. Also, some people, they have that lead therapy, in their home, their own house.
About 10% of our sales are to home use.
Okay,
Now,
so you
home
can buy
use,
them. Yeah.
yeah, home use I have it in my home. And like I said, I'm 73. And I tell people that health and well-being is like a candle that burns bright from the top down to the bottom and then sputters out and dies. But that's not how it usually happens in this country. In the last 10, maybe even 20 years of a person's life ain't always that great. They're not having fun. They're not mobile. They can't sometimes bathe themselves, feed themselves. They can't even wipe themselves. And the reason that happens sometimes is because people don't take care of themselves. And the reason why some people don't take care of themselves is because they don't know what they're doing to themselves and they're not scared enough of what their future is going to be. And I got scared really early on, because as a chiropractor, I had plenty of people that came to my office and I would think, oh God, please don't let me wind up like that they don't take care of themselves. So it forced me to really consider starting to really take nice care of myself. So I don't kill myself about it, but I exercise smart. I eat pretty smart. I don't drink alcohol, no soda, well, little soda, no alcohol. Try to stay away from the starches and the simple sugars. Those things are processed like sugar. If someone eats a bowl of pasta, the body consumes it like it's a bowl of sugar. Now, you wouldn't eat a bowl of sugar, so why would you eat a bowl of pasta? You can have it occasionally, but not as often as some people have it. So at any rate, there I am, manufacturing beds, having the time of our lives, seeing the kind of results that people are having, and it's unbelievable. We talked about the website, trifectalight.com. I also wrote a book that I do not make a dime from, but it's pretty good read on red light therapy. It's called Illuminated Healing. And I'm going to send you the show notes so you'll have this information that you can send to your audience. Then also we have a phenomenal YouTube channel. So if you go to YouTube and put in YouTube in the search line, the @ with Trifecta Light Official, I'll send you that as well. If you go there and get to YouTube with that, you're going to see some wonderful videos, like over 130. Some of them are just exceptional. So I highly recommend that you watch that or go there. Now, I wanted to mention this word infrared versus red and things like that so people understand. Red is red. It burns red, and it is red. Infrared, there's no such word as just infrared. It's either far infrared or near infrared. Far infrared is heat. Far infrared is the infrared saunas. Some people have infrared toasters. You can have infrared beds. That's heat. Heat is the enemy. Heat's the last thing we want when we're dealing with our lights. We use near infrared. Near infrared is considered cold. In fact, it used to be called cold laser, cold therapy. It doesn't get hot. If your device that you get, and people use all kinds of stuff out there, if it gets hot, it's bad news. It means it's junk. It means it's not really good. What you want to use is the highest grade, highest level of medical grade lights possible. And that's what we have. That's what I'm going to describe in a minute. But I want to finish up with, well, how does this work? And so here's what happens. The four elements of lights that we have in the bed, we have red and near infrared integrated together, four separate glorious wavelengths that we've magnified many times and drive it into the person's body. And once it's driven into the body, it will stimulate the tissues of the body, and it stimulates one particular element of the body. And so let's talk about this. The body's made up of tissues. The tissues are made up of cells, and every cell has a series of organelles, one of them which is called the mitochondria. And a mitochondria is the powerhouse of the body. It's the reason why you breathe oxygen and eat food, to create this molecule called ATP. ATP is the energy molecule of your body, energy currency of the body. And with the right amount of ATP, the person's going to do well. When you don't have the right amount of ATP because your body is struggling, your body is in disease process, you don't have the right amount of ATP, you will suffer, and it will lead to disease and eventually death. And by using the lights that I'm describing with our red light bed, that will reverse that and bring the mitochondria back to normal. I just want to give you some perspective here, how important the mitochondria are, that the mitochondria makes up 10% of your body weight. I want that to sink in so you understand we're talking about there's skin, there's bone, there's blood, there's hair, all this stuff. And still the mitochondria makes up 10% of your body weight. They didn't know this until more recent. When I went to school, we were taught there was one mitochondria in every cell of the body, and that's far from being true. They now know that there's, in many cases, thousands of mitochondria in every cell of certain parts of your body. So at any rate, the mitochondria is critical. These lights that we're describing from our bed will stimulate the mitochondria to come back to life. We call it the fountain of youth. I am telling you that the surprise out there is to all of us, the kind of results that we're seeing. And as we've gotten better and stronger lights that still don't get hot, that's where the science is. I don't have an objection to the stuff that people get on Amazon, the masks, the helmets, and all that. They're fun, they're toys, they're great, whatever. But when you want the miracles, first of all, you want head to toe coverage. You want medical grade lights that don't get hot. Again, heat is the enemy. Heat dilates blood vessels, brings more fluid to the surface, and that would block the penetration of the light. It makes the skin red. That would block the penetration of the light. You don't want heat. You also want that the top canopy comes right down onto the person's body. And most of the other devices out there, the lights are very far from the body. As you come away from the body, you lose power exponentially. And then the last thing about what you're looking for with our bed in particular has the ability to pulse the wave. You want to pulse that wave so that you can create what we call synchronizing frequencies or resonating frequencies. I don't know if you've ever heard of the word resonating. Resonating is when you have a high C tuning fork here and a high C tuning fork over here. When I hit this high C tuning fork over here, this one over here also vibrates because it's a resonating frequency. Well, the tissues in your body, many of them will resonate at different frequencies. And we can create that frequency with the bed. So not only are we creating power, not only are we creating the healing energy, but we're also creating resonating frequencies that will help make even the result, allow the results to be even better. So at any rate, that's pretty much it. If you can't tell, I'm crazy about this stuff. From a business point of view, I want you to understand that it's not satisfied patients that refer. It's excited people, and you're never gonna see more excited people, as you will, after they use this bed for a while. You know, like I said, after 2 weeks, they're gonna be crazy about this. And some people are gonna need a lot more treatment. Some people won't. I wanna make myself a note here to remind you that we include 32 things with the purchase of the bed. So when you get the bed, now remember, you go to the Contact Us page, on the right side of that page, on the left was finding a location closest to you. On the right side is exploring whether this makes sense for you to have this in your business. And if you're in the health industry, the fitness industry, the beauty industry, the weight loss industry, or if you're an athlete or in the athletic industry, you want to have this bed in your business. And, so it's, people ask me, well, who should buy it? I said, well, bookkeepers or accountants or, people like that who don't understand the body and they don't understand how to even attract people who are interested in their health. They're not great candidates. If you're used to being in the health industry, so the whole health industry or any of the other categories I mentioned, you're going to have great results with this and it's going to attract a lot of people. So it's like a magnet for the outside world to come to your office, but also the people that you already have there are going to flock to want it and fight to get on this bed. I mean, it's just it's a huge attraction.
So actually, I just realized that I'm getting red light therapy because I do like a particular facial once a month, and they put that thing on top of my face at the end. So it's not hot, but I can feel. So I have the protective goggles. I can feel it's really like bright. So I hope that's okay, right? But it doesn't feel hot.
Can't respond to the device that I've
Yeah.
never seen before. But I tell people don't wear the goggle. I'm not talking about you and that place. We're not talking about our machine. I don't want people wearing the goggles. Now, in the 50 years they've studied this technology, there's never been a recorded side effect. You couldn't hurt somebody if you tried. The
Okay.
light is very bright, so you don't want to keep
Yeah.
your eyes open the whole time. You could open it up for a second here and there. Not going to do any damage, but it's very annoying because it's very bright. But the reason why I don't want people wearing the goggles in our bed is because we want the light to get into the eye. And you think about what the eye has issues with. If you've ever heard of macular degeneration, macular edema, uveitis, if you ever heard of glaucoma, cataract, floaters, these things all respond beautifully to the red light therapy. So if we're wearing the goggles, you won't be able to get that energy in there. People get in the bed and they keep their eyes closed and their mouth open. So we move the teeth out of the way so we can get this incredible energy into the mouth. That includes for the gums, the gums, the tongue, the throat, the tonsils, and whatnot. It's very helpful for that. But even more so in the eyes, we had a guy who's probably 65 years old that had, I mean, we've heard a lot of this, but one guy in particular I just interviewed, so his video will be on YouTube probably starting next week. Because it has to go through, they got to process it and whatnot. And he started telling me that he went to his doctor and the doctor says, you have cataracts and we're going to need to have to do surgery. So several months later, when he goes for the surgical review, the guy sees this and he goes, what happened? Your cataracts are completely gone. And that's because he was using our bed. The
So
thing worked.
would you recommend still doing for people who have any kind of disease, still continuing their treatment, and on top of it you add the bed? Because if you have already like a treatment for anything, I don't know, blood pressure, cancer, whatever.
I'm
So
never
you
telling
continue.
anybody to stop doing what they're doing. I'm not allowed to, even if I was allowed to. Now, main thing is I never met that person. So how can I tell them what to do? I can
Hmm.
tell them what to add, which is red light therapy, which in the 50
Okay.
years has never been a recorded side effect. So we know that no harm's going to take place. But by law, I can't tell anybody to stop doing what they're doing.
Okay.
If you're
So yeah.
taking medication, don't stop. I'm not allowed to tell you that.
Okay. Is there any maybe any common mistake that people could do with red light therapy?
I did want to mention to you about contraindications. That's who should or should not use this bed. And technically, there really are no contraindications. So you can get in the bed with metal, with electronics like pacemaker or defibrillator, metal implants, shoulder replacement, anything metal is not contraindicated. None of that's contraindication indicated. The only contraindication is a legal one, and that's pregnant women. If
Yeah.
that baby is destined to come out anything other than normal, having nothing to do with our lights or anything else, and the baby comes out less than perfect, they're gonna wanna blame somebody for that, and I'm telling everybody that's with my company, let's not be in that neighborhood. And after the mother delivers, then let's treat the heck out of the mother, especially after a C-section. We're going to help her tremendously recovering from that C-section.
Okay. I mean, I just become recently a sound healer. So that's why when you were talking about resonating, I knew what you were talking about and the notes and everything. And I see a lot of my colleagues, they use that light therapy every day, every morning. They start with meditating. And then I see one of my colleagues, she's like in this little cocoon. So I don't know how much that costs, but it looks really expensive. And she's like in this little cocoon, all red. And I was thinking to myself, what is this? Because I didn't know anything about this, and now you explained to me, and I was like, "Is that dangerous? It looks like she's in a sauna and all that light. Is that good for your skin?" And she was saying it's really good for stress, emotion, and health. So now I understand better.
Competing pieces of equipment out there, but if you want the best, you want medical grade, high-end lights like ours, which is trifecta light. I mean, we've been compared to other companies, and invariably people get up there and tell us that they've experienced the others and nothing compares to ours.
And we can buy yours. I mean, if people want to have the bed in their house, it's possible for them to buy them, or they
Absolutely.
can
So
go
when you
to
go to
any
the
center.
website, you're gonna go to trifectalight.com. You're gonna go to the Contact Us page. You're gonna go to the right side of that page, and you can then talk to one of our professionals on whether this makes sense to incorporate in your life, whether it's at home or in your business. 90-something% of our sales are with businesses.
Hmm.
But there are people who recognize that, first of all, being sick is a very expensive thing. And if you'd like to be less sick in your life, or better said, if you want to be healthy in your life, incorporating red light therapy is a brilliant idea. It's not subtle. The results are spectacular.
I mean, personally, you had me at weight loss. So I go on the website and check if there's something close to my house.
But and also in regards to weight loss, obviously the person has to help. So if they're going to go home and pig out every night,
Yes.
the results won't be nearly as good as if they would cooperate.
That's too bad. I can wait for somebody to invent something I can pig out and still lose weight. But
It's never going to happen.
I know.
God's made sure that in some ways we have to take care of ourselves
Yeah,
actively.
I know.
And anyhow,
And have, goodwill. Well, you know what? That was the easiest interview I ever had because I asked like 3 questions and you answer all my questions without me asking. It was perfect. You know what you're talking about. You're very passionate. I can see that. And I mean, for me, that's a very good sell. And like I said, I already see a lot of people using this kind of technology. I use some a little bit on my skin. And like you say, yours is a very good high-end technology. So I hope people are going to go check it out. So please send me all the information. I can put them in the show notes. I think
we'll
I
do that.
already have some from you, but send me anything, you can send me. I would add them in the show notes and, people can check them out. Do you want to add anything else? Maybe we didn't, talk about any other advice for people?
Just try it. I would love to have you understand that I'm challenging each of you to get 6 visits. If you don't get those 6 visits, you're no longer allowed to complain.
Okay. It's like people voting and not voting and complaining about, what's going on. All
Exactly.
right.
Have a great rest of
Okay.
your day, okay?
Yeah, you too. And thank you very much, Dr. Carl, for all those precious information. I'm very
My
happy that we
pleasure.
talked today.
Take
Thank
care.
you.
Bye-bye.
Bye.